community, it is Shamika and I am back, and today we're talking about everything healthcare and human resources compliance. We will be doing a little bit of a Q&A, but we're going to do an improvised version of it, and we'll give you guys the option to ask some questions. So we have some of the questions that you guys have from the group and other platforms that will chime in. And you also, if you're joining us via the actual live Zoom, you can drop questions here during the Zoom, or if you're watching this in hashtag replay, you can definitely drop your questions there and we'll get them answered as well. So let's get started. If you don't know who I am, my name is Shamika. I am the founder and creator of the NOSA Group, the Nurse-Owned Staffing Agency. And we're excited to be having our first, I think, this month, live Q&A session. And the focus is going to be healthcare and human resources, and answer some of your questions, as well as give you some tips and some insight on things that you may want to consider to start doing in your business, or things that you may want to pause as far as getting done in your business. So let's get started. We have a question here from Joseph. He says, I am with Summit Healthcare Staffing located in Texas. I'm doing end-to-end recruiting, submitting payroll. What's the best way to hire? I'm interested, Joseph, do you have an applicant tracking system? And I guess when you say hire, are you talking about at the end of the process or the order of the hiring process? So while you respond to that, I'll bounce into our first question. And today we're only going to be doing 6 questions, but we'll do another session where we'll do some more questions as well. And this question is from one of our group members on YouTube, and it says, when it comes to travel nurses, how can staffing agencies ensure they're classifying employees correctly to avoid any mishaps with taxes and benefits? And this is a question that we talk about again and again and again. I think probably this summer we'll have some final legislation around what that looks like. And it really is a part of the W-2 versus 1099 conversation. So travel nurses can be classified in 2 different ways. And it's always a little bit tricky to kind of give a clear answer to a situation that kind of sits gray, because some of factors that you want to consider that are really key is what type of work is being done, right? How much control does the individual have over the work? And with a lot of platforms that are app-based, those individuals sometimes get, specified as 1099s, when indeed they're doing the same types of work as individuals coming in as W-2s or contractors. You want to talk about the work performed. You want to make sure you have an understanding as far as benefits, how permanent is the position. And then agencies really want to make sure that they have an idea of the level of control that the individual has on the work, right? So one thing to consider is what your state requires versus what you may want to do as a business owner. So there are, in most states, many states, state legislation around it. Who can be classified as a 1099, what classifies you as a 1099. But what I was referring to earlier is more of the federal conversation around nurses and staffing agencies and 1099 piece. But keep in mind, misclassifying your travel nurse as a 1099 instead of a W-2 can lead to tax penalties, can lead to other issues. So you want to make sure at whatever point you make the decision, which should be early on, that you're talking to qualified employment lawyers and employment consultants who can give you exactly what's going on in your respective state, as well as at a federal level if you're working with federal clients. Okay, Joseph has a follow-up to his question. So I would like to hire support staff. I feel like I'm losing contracts and getting more applications. So right now he's doing the end-to-end process. So from the posting up a job opening, and correct me if I'm wrong, Joseph, to actually running the payroll for that employee after they started working. So that's many steps in the process. And I would look at a couple of key factors when you're thinking about adding staff to help you with that compliance piece or credentialing piece, more credentialing and compliance. You really want to think about, one, are you in a position financially as a business to bring on staff to do that piece? You also want to consider, are you in a place as far as training and time? So could you, or would you have an hour, 2, 3 to work with someone to train them up to speed to do that piece of the business? and then how much is worth outsourcing, and then how much you want to keep in-house. In my opinion, the first few parts of the steps, which is the job posting, having people apply for the job, you know, submitting their resumes and any, you know, compliance requirements, CPR cards, TB tests, license information, that type of stuff can for sure be handled by a person outside of the initial internal agency. That's something that you can easily outsource. The submitting a payroll, confirming timesheets, that piece of it, I wouldn't say that I would recommend having it outside or outsourcing that piece as versus having it in-house, or maybe having it be a part of a dual role, or even considering automating it, because when things go wrong with payroll, and we've all had it happen, you want to be in the mix of it. So you want to have an understanding of, if the client is saying, oh, you guys billed X number of hours, this employee didn't work, or this employee only worked X number of hours, that you can jump in easily and correct it. So for me, I would maybe have a internal counterpart handling that piece before I would outsource it to a company like a virtual assistant type of company, or an accounting or services types of company. So that's my take. But the job posting, the application process, even the interviewing process can be outsourced. It just really requires that you take out the time to really train them. So train them in the way that you want them to do those particular roles and activities, to make sure that you're able to get the consistency that you need, especially from a human resources point of view, but also that you're able to get quality candidates. So have a person who, if you choose to have a person do this, has experience already doing it. So it's worth paying a little bit extra to have someone who has experience doing it, so that they understand, you know, what's a good candidate, what's not a good candidate, what you expect to see in resumes, so they can meet the needs of your clients. So I hope that answered your question, Joseph. So